Communication disorders. Communication disorders affect a person's ability to detect, receive, process, and comprehend the concepts or symbols necessary for communication. The communication process enables a person to pass on information, express their ideas and feelings, and understand other people's thoughts, emotions, and ideas. What are communication disorders? Communication disorders are a group of conditions involving problems with receiving, processing, sending, and comprehending various forms of information and communication, including concepts, verbal, non-verbal, graphic language, speech. What are the symptoms of communication disorders? Symptoms depend on the type and cause of the disorder. They can include repetitive sounds, misuse of words, inability to communicate in an understandable way, inability to comprehend messages. What cause communication disorders? Communication disorders can be developmental or acquired conditions. Causes include abnormal brain development, exposure to substance abuse or toxins before birth, cleft lip or palate, genetic factors, traumatic brain injuries, neurological disorders, strokes, tumors in the area used for communication. Who is at risk of communication disorders? Communication disorders are common in children. Nearly 1 in 12 children in the US have some form of communication disorder. The rates are highest among children aged 3 to 6 years and drop at an older age. Diagnosis. A doctor will need to perform a physical exam to diagnose communication disorders. This exam will involve examining a person's mouth, ears, and nose. If the doctor suspects a communication disorder, they will work with other specialists such as neurologists and speech language pathologists to make an accurate diagnosis. Common tests include hearing tests, neurological exam, psychometric testing to assess thinking, performance, and logical reasoning abilities, psychological testing to assess cognitive abilities, psychiatric evaluation if emotional and behavioral problems are also present, speech and language assessments, imaging tests such as an MRI or a CT scan, treatment of communication disorders. Communications treatment may include one or more of the following types of interventions. Speech therapy. Speech therapy to help children learn new vocabulary, organize their thoughts and beliefs, and correct grammatical or word errors. Behavior therapy. Behavior therapy designed to increase children's use of desirable communication behaviors, decrease their unwanted problem behaviors, and use of maladaptive coping strategies, and to promote their development of useful interpersonal skills. Stimulant medications. Stimulant medication as a treatment for any impulsivity or hyperactivity symptoms that may be present. Environmental modification. Environmental modification can also be an important part of treatment for communication disorders. For example, children with communication disorders can be given extra time during school-based discussions or oral test situations to more adequately formulate responses.